Hello, I'm Dr. Clint Sexton, and I'm talking about the functional medicine pyramid that I've created to help explain how we think about health, how we think about systems, and how they're interrelated. And so we have a hierarchy of systems we want to address in a certain order, or at least be evaluated as we're moving up and addressing conditions higher up in the pyramid. The one we talked about last was our brain health. So now we're going to be talking about the heart and or the cardiovascular system. Okay, seems pretty high up on the chart there, but let's talk about two major issues we have with heart health or our cardiovascular system. One would be heart disease. So we're talking about issues with cholesterol and inflammation and these kinds of issues that would lead to heart attack or stroke. Now, those kinds of conditions would be influenced by factors further down on the chart. So if we have chronic inflammation, that's going to start the process that can ultimately lead to these plaques that form in the arteries, or problems with the immune system, okay, or problems with lack of certain nutrients, which would be way down here at digestion. So we think of the heart as a rugged system, but and the vessels, but the point is what they're influenced by are much further down here. Okay, on our charts, we deal with these systems first in order to help address these that are higher up. So another cardiovascular issue would be high blood pressure or hypertension. Okay, and so ultimately that's really controlled by the nervous system. Okay, if you think about a lot of the medications, whether they're beta blockers, ACE inhibitors, calcium channel blockers, what they're doing is these are bypassing ultimately functions that should be occurring through your central nervous system, okay? So the medications are providing what we call an inhibition, okay? Causing blood vessels to relax and changing what the heart is doing, but those signals should be coming from the nervous system, but instead medications are being used to bypass what the nervous system should be doing, and that's why it's so high up here, because it's going to be influenced by what's going on with the brain and the nervous system, and that's why it's actually above the brain in this case, in terms of, not that I'm saying it's more important than the brain, it's just that's how you influence it. Okay, so if you'd like some more information on where the heart and cardiovascular system come into play when we're talking about the functional medicine pyramid, check out the blog. Thank you.